let's move on. The Kenya National Union of Nurses Secretary General Seth Panyako has condemned the shooting of a nurse attending to a patient at Chiromolen Medical Center on Wednesday. Police say the patient, a licensed gun holder, has a mental condition and had been rushed to the medical center by a relative.
The union wants first to say we condemn the act of shooting nurse who was on duty by a psychiatric patient. But I want first to go through official statement. Then I'll give my personal regards after I read the official statement from the union. The Kenya National Union of Nurses has learned with shock and disappointment the untimely death of a nurse by the name Fosdin Mwadilo Mwadime, who was fatally shot by an armed psychiatric patient in Chiromo Lane Medical Center on 6 December 2017. The union observes this as not only a sad episode, but also a reckless management failure of a health facility of historical proportion that permits psychiatric patients with loaded guns to be attended to by helpless nurses in an isolated ward, and have the following to say. Number one, we hasten to wholeheartedly as a union to condole with the widow, Ms. Doreen Akinyi, family of the bereaved, as we wish them strength during these hard times as they mourn their loved ones. The union will work closely with the family and the government to reach the bottom of the matter until justice is served. We demand the Inspector General of Police to inform the family, the nurses, friends, and the public how a psychiatric patient will be a licensed gun holder. How many more psychiatric patients are out there licensed as gun holders? We want to know the measure that has been put in place by the Inspector General of Police to ensure that those who are licensed to hold guns are not people who have mental instability. Otherwise, we are looking at a serious catastrophe where we have the Kenyan police licensing people who are mentally unstable to move around with loaded guns. If this thing is not checked and proper measures put in place, Kenya is treading on a very slippery ground in terms of security. We demand that the admitting
and in our